I'm Dr. Prahalad, Medical Oncologist from Narayana Health City, Bangalore. So I'm practicing as consultant in Bangalore.
So my first question is, what are the most common early signs and symptoms of the lung cancer?
So lung cancer again depends upon stage. Mostly we see with shortness of breath, cough. These are the most common symptoms. Persistent cough, breathing difficulty. Um, Sometimes unexplained weight loss. Patients having less appetite. Very rarely back pain. Some patients in advanced stages, if the cancer goes to the brain, they can have headache, vomiting, so multiple symptoms. Again, if it goes to liver, patients can have reduced appetite, sometimes jaundice. So mostly what we see is cough and breathing difficulty.
So what is the ideal age for screening, for the lung cancer?
Ideal age will be more than 55 years, especially those who have 20 pack year history of smoking. Especially the screening will be once in a year or once in 2 years. So with a low dose CT scan again. So especially those who have 20 pack year of history of smoking, like so one pack per day for 20 years. So we call it as 20-year pack history. So in those patients, the screening is definitely recommended to see detect a cancer at the earliest stage.
And ये कितने effective है ये screenings like lung cancer को detect करने में?
So screening में again see especially those who have screening again we have to take multiple factors because वो छोटा छोटा nodules रहता है वो टीबी के वजह से भी होता है क्योंकि इंडिया में tuberculosis बहुत common रहता है so again evaluating whether it's a solid nodule रहता है part solid nodule if it is a cystic nodule calcified nodule so multiple factors देखना होता है basically to see whether that nodule is progressively increasing. Again, detecting early stage might not affect the mortality or survival, but definitely we can pick up at an earlier stage so that especially those who have a strong smoking history.
ये जो हमारा नॉर्थ रीजन है लाइक बिहार यूपी, what delays you see in the patient from like this reason?
So I feel India may mostly we have a habit of tobacco smoking is very tobacco chewing and smoking are the common addictions we see in India. When it comes to again, it's not like north or south. Everywhere we see this tobacco and smoking. So that's the most common cause for the lung cancer in males. Especially we see oral cavity cancers. Those who have gutka, pan, all this. Kidney, all this can cause oral cavity cancer. So again, tobacco is the most important cause for the lung cancer in males. In females, again, cancer आता है, but mostly in India, females they will have no smoking history. But again, females में basically the EGFR positive करके EGFR करके एक mutation रहता है. So that mutation can have especially who have never smoked Asian population like India, फीमेल पॉपुलेशन इसमें EGFR पॉजिटिविटी रेट ज़्यादा रहता है इन स्मोकिंग ज़्यादा हिस्ट्री है तो EGFR पॉजिटिव रेट कम रहता है क्योंकि EGFR इज एपिडर्मल ग्रोथ फैक्टर रिसेप्टर वो पॉजिटिव म्यूटेशन में बेसिकली दोज पेशेंट्स विल हैव ए गुड लॉन्ग टर्म आउटकम्स.
Suppose if a patient is like smoking for 10 years and then he quit,
हाँ.
then is there chances of like lung cancer
Yeah,
after
so
once he quit?
basically, even in the previous history of smoking, also there is always a risk of cancer. So how many packs he has taken per day, how many years, all this again duration of symptoms, multiple reasons होता है. Even if he has quit smoking, also there is always a chance of getting a lung cancer.
But sometimes we say it's never late to quit. Like,
Yeah, so see, quitting is definitely important in multiple ways, even for the overall health being. It's not only the cancer, क्योंकि other than lung cancer, multiple cancers can be caused by smoking. Body में bladder cancer रहता है, और head and neck cancers. Many cancers get affected by smoking. So other than smoking, the quality of life, so well-being, social and mental well-being will be better if you quit smoking. So again, de-addiction programs are very important. Counseling how to quit the smoking, what are the ways of advantages of quitting smoking. Again, these aspects we should discuss in properly in case patient को नहीं हो पा रहा है तो फिर we have to send to a psychological counselor where they can counsel to quit the
I
smoking.
mean, how could the patients can reach to those counselors and care?
So again, depends on center where you practice. Again, some more is at the our center where we practice, we have a psychology department where we can counsel the patient, we can follow up the patient. If he's not able to quit, we have some other alternative nicotine stained gums रहता है. So if someone is not able to quit smoking, like placebo जैसा feel होता है वो nicotine stain gums के. So again, where you practice is very important. Again, we have at our own center who has a department to quit the smoking programs and all.
Could you explain the role of chemotherapy in this lung cancer?
Chemotherapy again depends on stage, again especially in stage 3 stage 4, mostly it will be in the form of neoadjuvant रहता है. So surgery के पहले है तो neoadjuvant metal followed by surgery. In case surgery के बाद देना है तो adjuvant chemotherapy बोलते हैं. So chemotherapy has multiple, either in neoadjuvant or adjuvant chemotherapy, or stage 4 में we call it as metastatic, it is palliative chemotherapy. So any chemotherapy can have good outcomes, especially good quality of life, good survival, especially in adjuvant neoadjuvant setting में the survival is definitely 5 to 6% improved with taking chemotherapy other than surgery. In metastatic setting, again we send a gene panel we call NGS panel, next generation sequencing panel. उसमें काफ़ी सारा genes रहता है. Based on those mutations, we decide on chemotherapy is must for all most of the lung cancer, especially in stage 4. Again depends on what mutation they have.
In your experience, how much people are aware about these surgical procedures, especially the less invasive
So
procedures?
again, surgically again depends on the skill of the surgeon. Again ये क्योंकि वैट्स करके रहता है, वीडियो असिस्टेड टोरोकोस्कोपिक सर्जरी, लोबेक्टमी रखता है, निमोनेक्टमी रहता है, काफ़ी सारे सर्जरीज रहता है. So again depends on surgeon skill of the surgeon, thoracic surgeon, those who is trained in doing lung cancer surgeries. Now minimally invasive techniques are very important. Awareness to the patient, counseling the patient is very important, because especially in stage 1 stage 2 stage 3, मल्टीपल मीडिएशनल नोट्स नहीं है, कन्फाइंड टू द लंग है, तो सर्जरी करने में आउटकम्स अच्छा रहता है. सो बेसिकली स्पेशली इन द अर्लियर स्टेजेस, सो सर्जरी इज़ वेरी इंपॉर्टेंट स्पेशली इन द अर्लियर स्टेजेस. स्टेज 3 में भी थोड़ा सा रोल है. व्हेन इट इज़ कन्फाइंड वेयर सर्जरी कर सकते हैं, देन स्टेज 3 में भी रोल है, बट स्टेज 4 में सर्जिकल रोल तो काफ़ी कम है, नो रोल है.
So, what follow-up like a patient needed after the chemotherapy and
सो
how long?
सो कीमोथेरेपी के बाद सो ये स्टेज 4 में स्पेशली वी कीप ऑन कंटिन्यूइंग वंस इन एवरी 3 वीक्स. वो एंड नहीं रहता है, एज लॉन्ग एज पेशेंट टॉलरेट कर रहा है, पेशेंट को ज़्यादा साइड इफेक्ट नहीं है, बीमारी कंट्रोल पे है, देन वी कीप कंटिन्यूइंग एज ए मेंटेनेंस. सो इन द न्यू एडजुवेंट एडजुवेंट सेटिंग, so we give for 6 months surgery, stop, and then once in 3 months, once in 6 months में चेकअप के लिए आना होता है. So especially in earlier stages, chemotherapy limited duration ही रहता है. So in that case, once in 3 4 months for first year, and then third year में once in 6 months is very important. Follow.
So, what one thing that every caregiver should understand, because like a patient always needs the emotional support and
Yeah. So again, caregiver, see, first of all, like cancer itself is very difficult to hear. Most of the patient वो cancer सुनने में डरते हैं. So basically, so the caregiver for basically social support is very important, because counseling for quitting smoking is very important. Family support is very important. Some people will be very young family, because ट्रीटमेंट के लिए बर्डन रहता है. सो मनी फाइनेंसेस, सो मल्टीपल बर्डन्स विल बी देयर. Emotional support, all these factors needs to be properly counseled, especially in stage 4. We should refer to a palliative care physician, where he can counsel the patient, so that all these emotional aspects can be dealt with.
any one message for your patients.
So basically, lung cancer is basically because of smoking. I would strongly suggest to quit smoking. If you have any problems, please consult your doctor, so that we can detect an earlier stage.
Thank you.